Okay. Hi, everyone. Welcome and happy Thursday. Thank you so much for sharing this hour with us. I imagine each of you enjoying a nice lunch, maybe with your shoes off, mainly just so we can settle in and be present with each other for this time. I'd also like to thank the Hummingbird Fund and the Compassionate Care Initiative for co-sponsoring this event with us. And of course, the Haney family for their support of our work. I'm Natalie May, and I am honored in several ways today. The first is to represent the Haney Conference Committee, the organizer of today's event. The Haney team is a unique and very cool collaborative representing UVA, Martha Jefferson, and Hospice of the Piedmont. I could tell stories about them, probably embarrass them a little bit, but I'm simply going to post all of their names in the chat. They're each dedicated care providers, and I am so proud to know and work with each of them. And as an aside, I'm also going to post other instructions and essential information in the chat during the hour so that you don't have to listen to my voice. Usually this is the time in the meeting where we tell people where the bathrooms are. And I always thought that was sort of a letdown. Anyway, my other honor is to know and consider one of our panelists, Dr. Jim Pluzogan, a friend. We talk a lot about wisdom and wisdom through adversity in my world, and Jim epitomizes wisdom in every single way. He married Peggy. What else do I need to say? But also in his pediatric practice, in his parenting, maybe even in his cooking, which is wonderful. And most certainly, however, in his journey with ALS. Jim has taught me that we can change the world by moving quietly, with purpose, with kindness, and with love. Jim, please know that you've made me a better person, and that was a heavy lift, I'm sure. Thank you for being here and for connecting us with I Am ALS. My final honor is to welcome this panel of individuals who have all managed to figure out a way to take a bad hand they were dealt, ALS, and make others the winners. We are all blessed by the work that they do, and I know we're looking forward to learning from all they have to share today. Panel, Mandy, I'm turning it over to you. Thank you so much for being here and helping us put this together.
Thank you all so much for being a part of this today and for having us. As Natalie mentioned, we're volunteers with the organization I Am ALS, and we're here today to tell you a little bit about the experiences that we've had as people impacted and living with ALS. First off, I want to make sure we all know that we're using the chat function. We do have a chat monitor today. That way we can make sure all of the comments that are submitted in the chat are read and appreciated. We will have a presentation for you, and then we'll have some time to open it up to questions and answers and a nice discussion. If there's a question that you have that you may not want to ask yourself, you'd like to ask anonymously, feel free to private message myself or to Mabeska, and we can make sure that we get those questions asked. But I'd like to start out by introducing the members of our panel. I'll start out. My name is Mandy Bailey, and I'm from Gulf Breeze, Florida. My connection to ALS is that I lost my stepdad to ALS in 2018. Juliet.
Hi, everyone. My name is Juliet Taylor. I live in Maryland. My connection to ALS is that I lost my husband, Jeff, to ALS in May of 2020. I was his caregiver and was able to keep him here at home with the help of hospice throughout our experience.
Tim Mabeska.
Thanks, Mandy. My name's Tim Mabeska. I live on the eastern shore of Maryland. I lost my wife, Mary Ann, to ALS in January 2019. I was her caregiver and also coordinated all aspects of her care. We had home hospice, and then she passed away at a hospice facility after spending the last 6 days of her life there.
Thanks, Tim. Jim?
Hi, everybody. Jim Pluzogan here. Natalie offered that warm introduction. She and I are friends from a long time ago, watched our kids grow up together, et cetera, worked on many projects here at UVA. Today, I'm here, though, with this wonderful group from IMALS as a part of the Tim Lowry panel and our community outreach team. I was diagnosed with ALS in December of 2022.
Thanks, Jim. Gia?
Hi, I'm Gia. I'm from Cleveland, Ohio. My connection to ALS is my father was diagnosed in May of 2021. He passed away 3 months ago, and my sister and I were lucky enough to be his primary caregivers, keeping him at home with the help of hospice at the end. And I was lucky enough to live with him for his last 4 months.
And Tim Lowry.
I'm Tim Lowry from Buffalo, New York. I was a pharmacist for almost 30 years before ALS forced me into early retirement in 2020. I was diagnosed with ALS in October 2018. I enjoy doing these panels to raise awareness and help educate healthcare professionals and healthcare students what it's like to live with ALS. Today, I am using my computer device as my voice along with chat to communicate. Thank you for allowing us to join you today.
Thanks, Tim. So now I'd like to talk a little bit about ALS, and I've got a slideshow that the team has put together. So bear with me a second as I share my screen. All right. Can everybody see that okay? All right, so let's get started. We all know that ALS, also known as Lou Gehrig's disease, is amyotrophic lateral sclerosis. And that's a mouthful. So what does that really mean? We know that ALS means that you're going to have gradual deterioration and death of your motor neurons, and it's going to cause the messages from your brain through your spinal cord to slow down and eventually stop. Your muscles are going to weaken. You may have twitches, and those muscles are eventually going to waste away or atrophy. Your brain is going to lose the ability to initiate and control your voluntary movement. And unfortunately, right now, there are no known cures or treatments that will reverse the disease. Every person with ALS is going to have their own unique progression, but there are some commonalities in the early symptoms. Muscle twitches in your arms, legs, shoulders, or tongue, muscle cramps, tightness, and spasticity. You might also have muscle weakness in your arms, legs, neck, your tongue, and your diaphragm. Slurred speech and nasal speech is also common, as well as difficulty chewing or swallowing and excess saliva. And when we discuss ALS, we typically lump it into two categories. If your symptoms begin in arms and legs, that's going to be limb onset. And if your symptoms begin with your speech and swallowing, that's bulbar onset. Diagnosis. And although many of you won't be involved in the diagnosis process, I think it's still important to know because this is going to help you understand your patients a little bit more and what they've been through when you see them. There is no definitive test for ALS. It's generally a diagnosis of exclusion. People who are in the process are going to get a detailed medical history of their symptoms. They're going to have a lot of tests ordered, EMGs, MRIs, blood tests, nerve conduction studies, muscle biopsies. And all these are going to help rule out those other diseases that might mimic ALS. And genetic testing is important. There are some treatments that target specific genes. About 10% of the ALS cases have family histories and a known genetic variant that's causative of ALS. And some people may have that genetic variant without a family history of the disease. More and more genetic variants of ALS are being discovered every year. And the path to diagnosis can be quite long and frustrating for many people. The correct diagnosis can often take longer than 12 months, because again, it's a process of exclusion and things take time. Your ALS symptoms that you're experiencing may also be common or mistaken with other less serious conditions that are potentially correctable with surgery or treatment. So you may even have possible surgeries that necessarily don't need to be done, but it's done because they think that that's what's happening with you. And it is typical to have multiple other diagnoses and even surgeries before arriving at an ALS diagnosis. A group of IMALS volunteers has recently started looking at some of the commonalities in the path to diagnosis and some of the red herrings that are common. Most common, stenosis and carpal tunnel syndrome. Over 50% had one or both of those diagnoses before reaching ALS. 1 out of 3 went through 2 separate misdiagnoses, and 1 person even went through 3 separate misdiagnoses. And 30% of our informal survey had at least 1 surgery before being diagnosed with ALS. So by the time that you're interacting with the patients, they've been through a lot. Their families are worn, they're battle weary. So I think it's important to know all of this so that you can come in and be an understanding and compassionate help to that family. Now, the next slide is something that you may not see very much. This is going to be used more in the diagnostic process, but it does give an idea of how a physician is going to come to that ALS diagnosis. And it is important to make sure that you get a prompt diagnosis when you're dealing with ALS, because there's so many different opportunities that might be closed off if there's a delay towards diagnosis. So whenever a physician is dealing with somebody that they suspect ALS, we always encourage them to be as clear and concise in any referrals that they're dealing with. Clinical suspicion for ALS. So that way we can get those wheels turning a little bit faster and hopefully give that person a little bit more time to do the things that matter. And like we said, a prompt diagnosis does matter. It is important, because you may end up being excluded from trials. There are quite a few trials going on in the ALS space, but the windows of eligibility are typically very slim. The longer it takes to reach your diagnosis, the fewer options that you're going to have. It's also going to delay the start of any medications or therapies that may prolong your life. And again, unnecessary surgeries, and then your bucket list. You want to make sure that you're giving the people that you're working with as much time as possible to live their days as best they can. And at the IMALS website, we've got some great information on clinical trials and the latest research. So I encourage you all just to take a minute and go through that when you can. What does progression look like in ALS? And again, everybody's going to have their own progression. It's very different from person to person. But most people that are living with ALS are going to die from respiratory failure. Emerging symptoms, like we mentioned, they're going to vary greatly from person to person. But you are going to experience muscle atrophy, and it's going to spread eventually through your entire body. There is a general timeline of progression that we have for people living with ALS. Again, very generalized. Everybody's going to be different. Your early stages of ALS are going to have muscle twitches, weakness. You're going to have fatigue. You may have some balance issues and slurred speech. Then the middle stages of your ALS progression, you're going to see all of those symptoms from the early stages begin to become a little bit more severe and impact you a little bit more. You might even have some paralysis. You're going to start having some difficulty in swallowing and eating and chewing. You may even begin having breathing issues. And then we have the pseudobulbar effect, and that's going to cause bouts of uncontrollable laughter or crying. Then the late stage of ALS, paralysis in most of your muscles. You're going to be extremely limited in your abilities to speak, breathe, eat, drink, and perform any of the functions that you need for daily living. What we know is that about 50% of people diagnosed with ALS are going to die within 3 years of that diagnosis. 90% will die within 5 years. And then you have 10% that might live for 10 years or more. Let's talk about some facts about ALS. We know that over 6,000 Americans are diagnosed each year. And at any given time, there are between 25 and 30,000 Americans living with ALS. Your lifetime risk of being given an ALS diagnosis is 1 in 300. So that means if you have a graduating class of 1,200 people, 4 will receive that diagnosis in their lifetime. We know that our military veterans are at least twice as likely to be diagnosed with ALS from the general public, and that's for a multitude of reasons. And there is research being done, but unfortunately, there's no hard and fast reason why our military veterans are at a greater risk. We do know that people with ALS burn calories faster and that malnutrition is a problem for these people. And currently, researchers are investigating toxic substances, viruses, potential trauma, and a multitude of other things as potential causes and triggers for ALS. But more people are starting to think that it's going to be a combination of factors, genetic and environmental, that's going to set off that ALS somewhere in your body and start that road for you. Treatments. We have very few treatments in ALS land right now. In 1941, that's when ALS really hit the map. That's when Lou Gehrig passed away. It took all the way until 1995 to come up with the very first treatment for ALS, riluzole. And that was believed to reduce motor neuron damage by decreasing glutamine levels between neurons. And it gave people who decided to take the treatment, it gave them a couple of months. Then in 2017, we got edaravone, and it slowed clinical decline of daily function by a few months. Then in 2022, we got Relyvrio, and it was approved to help slow disease progression. None of these drugs or treatments are going to cure ALS or reverse your symptoms, but they will give people a couple more months to be with their family, to make memories, and to live the life that they want to. There are also some current investigational therapies that are going to look at the immune system, stem cell therapies, suppression of those genetic variants, and mitochondrial performance. And there are many different medications, supplements, non-traditional treatments, and technology that can help patients manage the symptoms of ALS. But of course, we always encourage people to consult with their healthcare professional before trying anything new. So now I'd like to open it up for discussion. Please let us know what questions you have for us. We do have some questions prepared, but we would love to hear what's on your mind.
And Mandy, in the chat, Natalie has been nice enough to give us a rundown of the members of the Haney team. Jonathan Bartles from UVA Health, Hannah Barton from Hospice of the Piedmont, Peggy Bishop, Centara Martha Jefferson, Paula Copabiano, also with Centara Martha Jefferson, Leanne Johnson with the UVA School of Nursing, Natalie, and Brother Ignatius Perkins with the community, Anne-Marie Smith, UVA Health, and Rachel Palm with the community. Gives us panelists an idea of the varying focuses of these folks in their work.
Thank you to all the Haney team that's here. We appreciate you guys. So let's start with some questions. The first thing I want to do is I'd like for the panelists to discuss the diagnostic process that they went through. What hurdles they might have had, if there were any misdiagnosis that they faced. So Juliet, tell us a little bit about your husband's process.
Thanks, Mandy. So in fall of 2017, Jeff started to get some muscle cramping at night. It would wake him up at night, and we've all had those Charlie horses, right? So we didn't think too much of it. In the spring, he developed a foot drop. where he couldn't lift his foot to walk. And at that point, we thought it was orthopedic because we're lay people. Neither of us has any medical experience. So we sent him to the orthopedist. She said, this isn't orthopedic. It's more of a pain symptom or a neurological symptom. And we were sent to a pain specialist in that same practice, a young doctor who was astute enough to say, there are a lot of potential reasons for this, but we can't exclude ALS, which in retrospect, I'm incredibly grateful for her sharing that potential conclusion early, and helping us get further diagnostic testing. But we did go through, the ruling out of everything that Mandy described: MRIs, multiple ECGs, swallow study. Jeff had just returned from a business trip to Africa. So was this a tropical medicine issue? Ultimately, he was diagnosed. He wound up being diagnosed fairly quickly after ALS was mentioned in October of 2018. And we were fortunate enough to get a second opinion confirming that. Not fortunate to get the confirmation, but fortunate enough to get a quick appointment at Johns Hopkins a few weeks later. And his progression was fast, unfortunately. He lived for 19 months past diagnosis.
Mandy, there's a lot of chat activity. If I may just interject for a sec. Eric Davis says, thank you all for being here and reviewing this important topic. Ruby says, please tell us more about portrayals of ALS in the media and any common myths that can be busted. And we can talk about that during the course of this, Ruby, because there are common myths, like one of them is, the ice bucket challenge took care of this. Alex McGee says, is there anything that you wish spiritual care staff in a medical setting would do or understand? Any perspectives unique to ALS and spiritual care? We can address that as well. And then Jonathan says, Mr. Lowry, I'm from Buffalo. My sister who lives in Buffalo has ALS. Is there a higher rate in Western New York?
Awesome. Well, let's, panelists, do you mind if we address some of these questions that were sent in? I think these are fantastic questions. The first one, please tell us more about the portrayals of ALS in the media and any common myths that can be busted. Let's see. Jim, would you like to take this one?
No, not really. I saw Juliet nodding her head. I guess one of the main things is that I've encountered is that people, as I say, go to the end of the story. They know that ALS has no cure and that people are going to die of ALS. They go to the end of the story and they forget all the living that's happening with people that have ALS and their loved ones along the way. And like the work that's happening here with IMALS, with all of our volunteers that are connected with ALS, that activism sometimes gets lost in the shadow of the life-limiting illness.
Absolutely. Would any of our panelists like to share their thoughts on that question?
I'll pipe in. I agree. One of the, I think something that needs to be spoken on more is that from a public perspective, it needs to be reminded that ALS is not going to affect a patient's cognitive or emotional ability. And I just noticed sometimes when people would interact with my father, who was nonverbal and, immobile, that they spoke very differently to him. He's still there completely. And even me as his caregiver, it was hard for me sometimes. I would think, well, because I have to do so much for him, he can't possibly be the same dad up there, but he was, and that never went away. So I would just advise that anytime you are interacting with a patient with ALS, they are still warriors in their right mind, and they deserve that, that dignity.
Yes.
Jonathan in the chat, Tim has answered your question. My wife and I have tried to look into this. The CDC and ALS Association won't release specific information on location. And Ruby says, that is so powerful, Jim and Gia, thank you.
And I will say to the media portion of that, I've seen several TV shows, movies, series that I think have given people a bad idea of ALS. I think the most recent one was the Netflix series You People. And in the very beginning, within the first 5 minutes, there was the comment of, well, isn't ALS cured already? They had the ice bucket. It's the most paid disease ever. And to me, that is quite offensive because the majority of people that I know that are impacted by ALS, trust me, we're not the most paid. A lot of us are struggling to figure out how we're going to pay the medical bills that our loved ones are accumulating, how we're going to pay for that home care. And yeah, the Ice Bucket Challenge did raise millions of dollars, but we all know science takes quite a bit of money to make the progress that we really need. So that's kind of where I fit in with that question. Oh, and I see something in the chat. Tim Abeska, I've never loved the Ice Bucket Challenge. It scares me. What other ways can we help short of dumping ice water on people we love?
Well, you can get involved with IMALS. After this meeting, go to the website, imals.org, and you will see all the wonderful things that the organization does. It offers a chance to become an advocate, join one of our teams, and we have many teams, donate, or otherwise get involved. And, you know, we're not the only organization that is out there to help people with ALS, but we have support groups. We offer, services to people who've been newly diagnosed and their caregivers to walk them through the process of getting help. And we do many other things. As long as I've got the floor, one of the myths that I'd like to bust is that ALS is an old white man's disease, because it's not. It affects everybody, everywhere, people of color. We have many people, unfortunately, in our community who were diagnosed in their 20s. This is something that can affect anyone, anywhere, anytime.
I'd also like to say, from a helping perspective, if someone's not ready, or you're in school, or you have a lot to commit, you're not ready to be part of a group, just following IMALS on social media channels and helping us amplify posts to your audience, I think is so important, because awareness starts with the folks outside of our immediate group. And that's huge. Before my dad was diagnosed with ALS, I knew the Ice Bucket Challenge, and that was all I knew. That's all I associated it with, because I was never in that circle. So follow IMALS. There's so many other organizations. I mean, we could rattle off a ton, but to start with IMALS and just Facebook, Twitter, Instagram, and just amplify those posts with us.
And in the Q&A, there's just a comment that there's a ride for ALS at Pro Reynata in Crozet on May 15th. This is the kind of thing where there are a lot of these types of events. In whatever it is, 2 or 3 weeks, Juliet is running in a half marathon for a ALS event. Mandy has been to ALS events. There's a lot of these out there that are intended to raise money and raise awareness for the disease.
Yeah, one point I wanted to make that maybe ties a few of these things together, back to the question about how ALS is portrayed. I'm always happy to see when there's an ALS film or documentary that's out, in the general public, because we do want people to be aware. But, as Mandy said, sometimes these perpetuate misconceptions. And one of the misconceptions is that somehow this is some romantic journey, and that, it portrays ALS, I think, quite differently than the reality. The truth is that, you can have an incredibly rich, beautiful, meaningful life with your loved one, or if you're living with ALS throughout, but it's very infrequently, in my experience, what it looks like on TV. And I wish that we could find a way to do a better job of making people more aware of, what families with ALS go through financially, with regard to caregiving, with regard to nutrition, with regard to transportation, with regard to general quality of life. And then also, care for the caregiver, which I think is one thing that hospice does incredibly well. So, it's never quite as it's presented on TV and film.
In the chat, we have detailed instructions for getting your continuing education credit, which I'm not going to read, but if that affects you, please hit the chat. And then Kathy Campbell says, thank you for reminding us of the diversity of people living with ALS.
And I think it's important to recognize that diversity, because that could lead to a prompt diagnosis for somebody that doesn't fit the stereotypical person living with ALS. Recently in our community, there has been the loss of a young child. A lot of us in the community are familiar with a little boy named King Nazir, and he not even 10 years old. So it shows, and it just illustrates that this can and will affect anybody at any time. It is the non-discriminatory disease for sure. So let's look at this next question that we got in the chat. Is there anything that you wish spiritual care staff in a medical setting would do or understand? Any perspectives unique to ALS and spiritual care, also called chaplaincy? Who would like to take that first? Tim? Give it a try, bud.
Health is extremely important, as it is for all of us. In my adult life, I've worked on my mental health and spirituality. I continue to read. In fact, I read now more than ever. Readings that vary from Eastern and Western religions, philosophy, and stories of inspiring people. It has helped me have deeper and more meaningful relationships with family, friends, colleagues, and nature. So each day I start with my meditation and focus on what I'm grateful for. I have to let go of seeing and doing things as I used to. Some call it honoring the pain, except where I'm at, be honest with myself, then adapt and grow however I need to. This doesn't mean I stop fighting. It means I need to reframe, realign, and move forward. Being an advocate for ALS and working on these panels with this great group of friends is a big boost. There are times I may ask a certain friend over who I think will lift my spirits. I'm also lucky enough to be married to a wonderful woman who I love spending time with. By no means do I assume I have all the answers, nor do I pretend that this is easy. I embrace each day and look for what ALS has to teach me about myself.
Thank you, Tim. That's awesome. Tim Abeska?
So to specifically address the chaplaincy piece of this, you probably already know that the variety of situations that you are going to encounter will vary depending on who the patient is that is in the end stages of life, who the caregiver is that at that point is not really thinking clearly, and is probably sleep deprived and trying to figure out what the best way to do to help their loved one die a good death. Obviously, you need to bring compassion to the table, thoughtful prayer, talk to the family about what the person would want, because it's, everybody's different. And I wanted my wife to see a priest before she died, and she just wasn't interested in that. But one of her cousins came in the room 10 hours before she died and prayed with us. And I'm convinced that that gave her what she needed to go, the sense of peace that she needed.
My father was extremely Catholic from baptism to the end of his life. We were raised very Catholic. And there's a plaque in the church that says the Polo family. I think that sense of peace that like physically going to mass provided for him was hard to adjust to not having that, kind of that hour of quiet and reflection for him. We too, on my dad's final day, we had him anointed about 2 weeks prior to him passing with a priest coming in. And then we had a priest come in, it was about 2 hours before he passed that night. It's important. I don't know. I think it's huge. I think we only met with our hospice organization. We only met the spiritual leader once or twice. Granted, we weren't on for very long, but I know that gave, my dad some comfort that there was a piece to that spirituality.
Yeah, and I'll agree with everything they said and chime in. While you're there in the situation, wherever you're going to be with the person impacted by ALS, there's going to be a caregiver there that is battle weary and may not quite be able to express themselves to you and how much they need just that quiet peace that spiritual part can bring. So just giving them that space to feel and just even sitting quietly with them and letting them go through their feelings and just ramble on. I think that's an important thing to do and to recognize that this disease is going to affect so many more people than just that one person diagnosed. And the service and the care and the love that you're going to provide for that situation is going to make such a huge difference in all of their lives. And it's a difficult place to be in. I know our pastor came over in the middle of the night when my stepdad passed, and he may not have said much, but he was there, and he was there if we needed a prayer, a hug, anything. And that meant the world. That really helped take some of the sting out of a really rough situation. So I think that's something that y'all can offer from the spiritual piece of it. Anybody else want to add in?
I'll just share. Jeff was not traditionally religious, but very spiritual, and he found spirituality in nature. And when he was diagnosed, we knew we would need to move to a mobility-friendly home, and we found this home that I'm in now, which is 1 floor and completely mobility-friendly, but it also has, it's a big room that looks out on the water. And so, to be honest, we cared for Jeff in his final days here in front of the windows, where he was able to see the creek and the ducks and the squirrels and the birds, and it brought him an incredible amount of peace. I know that because he shared it with me. So I think the reason I bring this up is that depending on the person you're caring for, depending on how they view spirituality and religion, different things might bring them peace and comfort. So keep that in mind as well.
And in the chat, Jonathan says, my sister each day prays a meditation of gratitude, grateful for her breath, her life, and yes, her challenge. Faith brings her such a zest for life. Thank you for sharing that, Jonathan.
Hey, Jonathan, I'm glad you're here. I'd like to add a different perspective here, and that is, that when given a diagnosis of ALS, it's an existential crisis. And often it's hard to find language to really, especially at the beginning, to describe and or process the rapid rapidly changing life that ensues with ALS. And I think maybe a chaplain or someone that's comfortable talking about all manner of things that are existentially oriented could be the person to sit with someone and just, as Mandy was saying, let some of this unfold. Because I think sometimes we find the meaning through our language, but it's not always apparent. It's not well organized, certainly at the beginning, and it evolves over time. So allowing someone to question things and explore things that they might have trouble finding language for could be incredibly useful. And not just the patient, we're a unit with the caregivers, and the caregivers are as much a part of this as the patient.
In the chat, Natalie says, I think what's on all of our minds is the downside of virtual panels. No one can reach over and pat your hand or hand you a tissue. Consider this a virtual hand squeeze. And, that actually brings up another side of the ALS experience that I'm sure all of us have felt on the panel at one or another time. Everybody tells you that ALS is a rare disease. So a lot of people feel so isolated by that. But by being able to be involved in a community like I Am ALS and initiatives like this, we're able to connect, and we feel these virtual hugs, we feel these virtual squeezes when we're having these difficult discussions. And being a part of a community like this is so important to people, I feel, because it does give you that sense of community. You're able to pull from all of these different people. I've learned from Jim how to put things into words that I can't necessarily express. He's given me some great words. Juliet and Tim, I've learned how to put some of these things in the past and to find happiness in other different ways. There's just so much that a community can provide. So when you're talking to people, encourage them to find a community, find people that have those same shared experiences, because it really can make a huge impact on your quality of life.
And in the chat, Tim Lowry has generously shared his email address, inviting people to reach out if they want more information or questions from him.
So let's take another question, guys. Let's talk about what we do to help people, help our people live more productive lives. What are we doing to put meaning in our days after an ALS diagnosis? Jim, would you like to start?
Sure. It may be obvious, but it's worth saying that when you're diagnosed with ALS, your life is not stopping. You continue to live your life with ALS. So that takes some integration. It is a big change, and there's a lot of grief with all the losses that come, and keeping up with that is really important. But Natalie mentioned my wife Peggy at the top of this, who together with Natalie has published on wisdom and wisdom in medicine. And so because I hang out with them, I've learned some things. And one of the things I've learned is that we always have a choice when facing adversity. And one of the things that we can do that's helpful to derive meaning from adversity, like an ALS diagnosis, is to step in. And to, after acceptance and moving forward, there's the opportunity to step into it and find a way to make a difference. So for my family and for me, creating the Hummingbird Fund that locally here is able to really make a big difference locally has been transformational. And for my family and me, being involved in I Am ALS and the different committees and work groups that are here has allowed us to share our experience, our expertise, and yes, be a part of a community. I call it my new kin, but it's an opportunity to move forward, and I say continue living with ALS. It may be that's not the best way to say it, but you understand what I'm saying. It's the way to integrate the reality of ALS with a continued productive, meaningful life.
And Lisa, in the chat, I want to thank you for sharing this. You say, I have a close friend diagnosed recently with ALS advanced stage, diaphragm paralysis. He lives in another state and has a very isolated life and little help. I want to help and talk with him daily, but how can I impact his life positively? Maybe some of the chaplains on this call can help with that. But I think, the fact that you talk to him and communicate with him and shows him that he is important to you. And that probably is the best thing you can do given the geographic distance.
I agree with that, Tim. Just letting that person know that you're still there. Because I found with my stepdad, some people just, the friendships kind of backed off because they didn't know what to say. It's uncomfortable and it's hard, and we get that. But just being there and letting them know that you still want to maintain that friendship, you still want to be a part of their life, that's everything right there.
I agree. And I would also say too, tapping into memories was really big for my dad. Like, just like Mandy said, like a lot of his friendships, they just tapered off. And my uncle showed up once a week, every Thursday at 4:00. It was a standing appointment. And but memories, like just talking about old times. At first I felt like, well, is this gonna be like not positive? But it made him smile and it made him think back on things. And if you don't have the words for memories, just from personal experience, Juliet might agree with this, but like music is tied so much to memory. So sharing songs that bring you back to whatever memories you have or songs he likes, that's huge to me. At least with my dad, it was one of my favorite memories of just watching on an afternoon with my sister and him and my mom, like watching YouTube videos of music.
With Jeff, Jeff was one of 7 kids, adult kids. They were all grown at this point, but 2 weeks before COVID shut everything down, and obviously we couldn't have known that was going to happen, he and I drove to Michigan in the mobility van. That's where his family was from. And everybody moved into his sister's house for a week together. It was like adult camp. And Jeff said it was the best week of his life. And that made it the best week of my life because we were all just together. So much laughter, so many memories, just like Gia said, so much music. Obviously with geographic considerations, that's not necessarily doable, but I think the fact that you're asking the question is incredible. And I came to think of things as, we had 2 groups of family and friends, and we all understand it can be really uncomfortable, but we had people that ran away from fear and that ran toward fear. They were scared like we were, but they came rushing at us, and you can just feel it. And it doesn't even require physical presence to run toward the fear. Just letting them know that they're in your thoughts is a really effective way to just be present for somebody.
Awesome. I want to switch gears just slightly since we've got about 9 minutes left of the hour. This went by so fast, y'all. I would like for our panelists to take a minute and tell us, what would we want people to know about ALS? If there's something that you could impart to the audience. Tim Lowry, you want to try this one?
I want people to understand that I'm still here inside this body, even if I have trouble talking or moving about. I may not talk well, but I'm not deaf. Don't take pity on me, because I don't. Interact with me like you do others. It just might take me longer. I want people to just be a little more patient than normal. When I'm typing with my eyes as I think, hearing what I have to say can be fun and possibly / worthwhile.
Tim, you always say worthwhile things. I love it. And I think he touches on something really important that's what I would want people to know is your life doesn't end at that diagnosis. There's so many things that you can still accomplish and do. And some of the most incredible things that I know that my friends have been done by people living with and impacted by ALS. You know, we've got a friend who has written several books with her eyes. We have a gentleman that was on our veterans team that did a short run for Congress. He's also been on, I think, the Paralympic hand cycling team. So there's so much that you can still do despite an ALS diagnosis. Juliet, what would you like people to know about ALS?
I'll be brief. I don't think I could say it any better than Tim Lowry. Jeff and my friends living with ALS are no different than they were before ALS, internally, emotionally. We wanted to live our life with as much dignity for Jeff as possible. I still learned so much from him. We had an incredible marriage and a great relationship, and that just grew richer and closer during his time with ALS. It makes it more difficult, you know, now that he's not here, but you know, I think so many of us are doing what we're doing because we were just astounded by the you know, the richness of life of people living with ALS, and want to help make sure that people understand that.
Awesome. Tim Abeska?
I'm going to come at this from a little bit of a different direction because I want to dovetail on a passing comment that was made by somebody earlier about the financial cost of this disease. Because when you are with hospice or a nurse or wherever you're coming at this from, you know, you're not in general seeing people at their best, but you're also seeing people who are typically under extreme financial pressure because this is a horrendously expensive disease to have to deal with. Everything costs a lot of money. This latest drug, Relivrio, is horrendously expensive. And you know, I hate to use the word lucky and ALS in the same sentence, but because my wife was an Air Force veteran, that opened up to us a host of benefits through the VA that, you know, included modifications to our house and the purchase of a mobility van, things that, you know, the average person would be struggling to deal with.
Yes. Gia?
Yeah, I would just probably say two things. I would say that ALS steals so much of your identity as a patient with ALS and as a caregiver with ALS, but it does not become your whole identity. There's so much more that's going on, and there's just you're not just an ALS patient. I don't know, that was just important to me. I wasn't just an ALS caregiver, but it does steal lots of pieces of your identity, especially when you're a wife caring for a husband or a daughter caring for a father, husband caring for a wife. But just know there's still a person back there.
And Jim, we are telling something that we wish people would know about ALS.
Yeah, I think I'd like to offer three quick things. One is, don't forget the caregivers and the families. We're all going through this together. It's important to reach out to those folks and check in with how they're doing as well. It's a unit. The caregiver patient is a unit. And so remember that. Secondly, the march toward disability that is ALS takes a mountain of energy. And so just be aware that all these things that everybody's mentioned here, you know, is a new reality in people's lives that just occupies an immense amount of time, energy, money, and a little kindness around that is probably well worth the effort with the families. And the last thing I want to say is that I have learned that there is such a thing as post-traumatic growth, that people can grow and develop and expand, and positive things can come from tragedy. And that's not to minimize the tragedy. That's just to say that in certain circumstances, with certain support, there's opportunity for growth. And so sometimes the perspective dealing with someone with ALS with such a tragic diagnosis and this trajectory toward loss and death, sometimes that takes precedence over how are you growing? How are you changing? So asking us sometimes, what's bringing you joy in your life these days? And, where's the love today is, I think, as equal and important as checking in with how we're managing our disability.
I like that. And I absolutely agree with that post-traumatic growth. I'm sure the people on this panel that have been left behind, for lack of a better word, by our loved ones, I'm sure we can all say that we're not the same person that we were before. I know myself, I think I am a much better person because I've seen what it can do, and I found a way to fight back against it. And I think that has helped me tremendously. But I do want to take the time to thank you all for joining us for this panel. There's things that I'm sure you've learned that you won't ever learn in any textbook, and that's why these are so incredibly valuable. If you have any questions, Tim left his email in the comments. Please shoot us any questions. We'd be happy to answer anything that you have. We're an open book. Again, you can also go to IMALS to learn more about our organization, who we are and what we do, and how you can get involved. And I will go into the chat real quick. Edward says, thank you for bravely sharing your experiences surrounding ALS. This was very informative. It takes a village to address this, and I will do my best to continue amplifying IMALS's messages. Thank you for all your efforts. And we've got a bunch of thank yous in the comments. Juliet has also left her email address, and Tim has as well. Please feel free to reach out anytime. Consider us your resource. Thank you for joining us today. We really, really appreciate it.
Thank you so much, panel. This was wonderful. So I hope you all have a wonderful day, panelists, audience out there. Thank you.